Everybody, 5 seconds. Okay. Thank you everybody for coming here today. I want to update all of you on what's proceeding provincially and locally as it relates to COVID-19 pandemic planning. As you know, it's evolving by the hour. The projections as stated by our Provincial Medical Officer of Health and the CDC, and what we talked about at our last town hall, is that there's going to be considerable community spread over the next week. That means we will have person-to-person spread without directly related travel. We need to continue to try to restrict spread through proper hand hygiene, staying away from each other from 6 feet, avoid mass gatherings like sporting events, conferences, concerts, and charitable dinners, which you've seen over the last couple of days have all been canceled. As a result, we must plan for the worst. We will wait for the Hotel Dieu physician COVID results. One point of clarity is he does not provide services at Windsor Regional Hospital, and he did not attend Windsor Regional Hospital. All people the physician came in contact with have been notified, and we pray for him and others impacted. However, at this point, he's still waiting for results. As we outlined in the last town hall and the daily emails I send, is the province is focusing now on creating what's called COVID-19 assessment centers. These are meant to be a place for patients in the community to attend if they might be impacted by COVID-19. The goal clearly is to have people call still public health, telehealth, or their primary care practitioners before they attend a hospital, primary care, or clinic to avoid community spread. That needs to still continue. The COVID-19 assessment center needs to be close to an emergency department in case patient needs ER support or possibly a hospital admission. Last night, we were approved to open a COVID-19 assessment center at our Ouellette campus first. It will be in the current ambulatory area next to the emergency department at Ouellette. It will have its own entrance from the parking lot and will not be accessible to the hospital, as well as you will not be able to access it from the hospital. It's going to open Monday morning, March 16th at 9 a.m. You're going to hear more about this over the next couple of days. It's going to start opening 9 a.m. to 4 p.m. daily, with hours expanded when volumes increase. The province wants to be in front of this issue rather than reactive. The eventual plan is to open another COVID-19 assessment center at the Met campus in the current endoscopy area. Again, segregated from the emergency department, and for those of you who are around, we actually opened it when we had H1N1. We used it as a screening area at that point. One of the things for these that we need to collectively talk to the community about, just because you go to the COVID assessment area does not mean you are going to receive a COVID test. You still need to meet the case definition to receive that test. So we've had individuals that have come to the emergency department last night. Unfortunately, we had a group of 4 individuals who were shopping in Michigan who stopped at the emergency department and asked to be tested for COVID. Guess what? They don't qualify, and that's a waste of time and resources for all of you here. So we are communicating to the public, stop that. We can't have that continue. We have to focus on individuals who meet the case definition, who are ill and suffering and symptomatic of COVID, and that's the way we're going to get through this. At this moment, of course, still to this moment, we do not have a positive local case of COVID-19. There's all sorts of rumors, speculation on a minute-by-minute basis. And again, I stress none of us participate in those rumors, be it on social media or otherwise. As soon as we get one, which we probably will, it'll be notified. Either we're going to be notifying it, public health are going to be notifying it, but definitely the province of Ontario will be notifying it. So it's going to be one of the 3 is going to be notifying it, but it's going to be coming, so expect it. It's going to be here. Also, as you know, we implemented visitor restrictions. They're going to start Saturday morning at 12:01 a.m. That release has gone out. We're communicating on social media. And what we're asking is the programs, floors, and areas are being asked to monitor, and if people will not comply, because there's always a transition. We've been through this before. There's always a transition period where people didn't know, and they come in and they get to the floor, and there's too many of them. If they won't leave, we'll make sure you have enough of the press release printed off, available, then call security and we'll ask them to leave, okay? But these things transition as we move forward. All 3 local hospitals are working together as outlined in the pandemic plan, and this will most likely escalate further as outlined in the pandemic plan, meaning some of the next stages we're gonna have are gonna be restricted entrances, and all of you, along with visitors, are probably gonna have to be screened coming through those entrances. Expect that to evolve probably over the next 96 hours, if not longer, as this evolves. That's gonna start happening. So start seeing that, be ready for that. Also, as stated in the pandemic plan that all of you have access to, it talks about starting to restrict services at the hospital to be focusing on just emergency services, and non-emergent services will be delayed or postponed. Again, that's not happening right now, but expect that to happen if this continues to escalate with the path it's going. So please review the pandemic plan for your area and the hospital for that matter, and ask questions. There's no such thing as a wrong question, and some of you have asked. If for some reason you send me an email and I literally don't respond within 6 hours, call me. That means I missed it. Needless to say, right now, getting a few emails. So if you could, if I don't call you back in 6 hours, that means I missed it. Please call me. You got my cell phone, call me on my cell, and I will answer your question verbally, and I'll follow it up in writing, and I'll make sure it connects with the right people too, because some of you have emailed me, and what I do is I try to answer the best I can, but also connect you with the people that can help you further with whatever question you might have with respect to this. So again, you're going to start probably seeing screening at the various entrances in the very near future. And I truly want to thank our retirees. So you know, we've already had 50 of them willing to come back and help us. So we are connecting with them, and they're going to help us with the screening. So that's fantastic. So I now am going to ask Karen Riddell, who's the VP of, among other things, infection control, to come up and talk to you about some recent information that is happening, and then I will close it off after Karen speaks.
Can everybody hear me? Okay. I don't usually have to wear a microphone, but I'll do it today. Hi, everybody at Alette. So everybody's probably heard, and I know that David's had it in his updates, that we were expecting some guidance from the ministry with regards to PPE and COVID-19. So we did receive the updated documents last night. Our team did meet this morning to review those and apply them to our current situation and make recommendations with regards to our own internal protocols. And we do have a meeting set up later this afternoon with Joint Health and Safety. So what I'm going to do is review with you now how those new guidance documents impact what we've been doing and what we'll be doing moving forward. So the key change, and these changes are based on research and evidence and the scientific evidence around transmissibility of this virus. So the recommendation moving forward for routine care is droplet contact precautions for a suspect or confirmed case of COVID-19 with added airborne precautions when there is an aerosol generating medical procedure. As you know, droplet contact precautions includes a mask, eye protection, gown, and gloves. So all healthcare staff that are entering a patient room with a patient that is suspect or confirmed COVID-19 should be wearing that PPE. In addition, if there is an airborne precaution added to that for an aerosol generating procedure, that you would have an N95 instead of just a regular procedure mask, okay? So if they are in place, airborne precautions for an aerosol generating procedure, only those staff that are providing that care for that patient and participating in that procedure would be in the patient room. Okay. So aerosol generating procedures, just for everybody in the room for clarity from this document, include endotracheal intubation, cardiopulmonary resuscitation, open airway suctioning, bronchoscopy, surgery and autopsy, sputum induction, non-invasive positive pressure ventilation for acute respiratory failure, so more commonly we hear CPAP and BiPAP, and high flow oxygen therapy. So anytime those procedures are occurring, that would require, that would be classified as an aerosol generating procedure requiring airborne precautions in addition to the droplet contact. So one of the things that was not included in this document as an aerosol generating procedure is the performance of nasopharyngeal swabs, which is the test performed on a patient that is being tested for COVID-19. So we had some discussion around that, and because all of the infection control related guidance documents still have that listed as an aerosol generating procedure, we are going to maintain airborne precautions for that procedure. So any staff performing a nasopharyngeal swab should be wearing an N95 in addition to the droplet contact precautions. Okay. So the document also has recommendations related to screening and other contact with patients. So for screening, they do recommend, so if you're just talking to a patient and you're doing the IPAC screen, that you maintain a distance of 2 meters or a physical barrier. And if there is a physical barrier or that 2 meter separation, then no PPE is required for that. So that is just routine screening. Otherwise, if you can't do that, then droplet contact precautions are recommended for that screening. Okay. So we are in the process of, facilities is working very diligently right now to add plexiglass barriers at high volume screening areas. And I know as we're setting up moving forward screening areas for staff and visitors that we're looking to add those barriers as well for people. And all other areas, so just walking around the hall, not having contact with patients that are being ruled out or confirmed, you do not require PPE, it's routine practices, okay? Any patients that have respiratory symptoms should be wearing a mask, and that is the same for COVID-19. So if the patient is coming out of their room, they should be wearing a mask. And as David mentioned, so we are going to be have an assessment center opening up next week. And we will be having our PPE recommendations associated with that screening center. And we will be having our staff wearing N95s that are doing the nasopharyngeal swabs. And then last but not least, we are in the process of developing some communication for the emergency departments so that they can inform the public coming in just for screening that don't meet criteria where they should be going. So going to their primary care, calling telehealth, but not coming to the emergency department. And I think that is my piece done. I'll hand it back to David.
Thanks, Karen. And as Karen, the inference stated as well as myself, is if you have issues or have questions, always follow the rule of 2, which is talk to someone else. Talk to one of your colleagues. I don't know if you hear the beeping. It's kind of, I don't know if that's, you guys hear like a stuttering in the back? Yeah. I don't know what that is. Oh, that's what it is. Vibrating. Okay, solved, thank you. Rule of 2, always follow it, is if you have a question yourself, ask one of your colleagues or escalate it. Pick up the phone, talk to somebody. I'm available 24/7. I'll wake up in the middle of the night. Karen Riddell will do the same thing. There's multiple people. You have your supervisor, admin on call. There's someone on call 24/7. You might not get them in 2 seconds. You might not get me in 2 seconds, but I'll definitely call you back in a reasonable amount of time, if not immediately pick up the phone. So pick up the phone. Worst case scenario is I won't be able to answer your question, but I will connect you with someone who can answer your question. And again, I think that's good practice anyhow to follow, be it on the unit or anywhere. Ask someone. Don't feel you got to make this decision on your own. Ask someone what they think. And if the two of you can't solve it, then keep escalating as you go. Now, I know some of you are going away for March break. Needless to say, be safe with respect to that. Again, if you're traveling outside of Canada, and especially to one of the impacted countries or areas, you have to call employee health before you return to work to get clearance, and that's going to morph over the next week. The rules that are in place today are going to be different on March 23rd for sure. So you got to keep yourself up to breast on those. And again, if you have questions, pick up the phone and ask. Call employee health, ask them. They will work with infection control and get you the answers as things change. But again, if you're going away, especially if you're leaving Canada or leaving this region, use your best judgment with respect to that. But it's very difficult right now, and things, as you can tell by the hour, are changing with respect to where you can travel and where you should be traveling. I'm going to close with the following. To me, it's very important. We're at a moment right now where us as healthcare individuals here at Met and Olette, this is it, folks. This is where our community relies upon us. You set the example. You are here in healthcare for this very reason, to help people, to care for people. This is our moment to set an example of giving correct information as well as not creating unneeded panic. People rely upon you. And I'll give you an example. Dr. Saad stated he was in church the other day, a couple weeks ago, and it was communion time, and a couple days later he found out people were standing behind him, sitting behind him. And they said they were going to take the lead from him whether to go up for communion or not. Folks, people know who you are. I don't care what classification you are in this organization. They know where you work. So it's time for us to individually and collectively lead, not create unneeded panic. And I know it's stressful, and I know we all have our individual anxieties and our concerns. And that's where you lean on each other to share those concerns and deal with those anxieties. But when it comes to the public, it's time to step up. Anyone who's been in healthcare, this is not a surprise. In SARS, I couldn't have given this speech because it was kind of all new to everybody. But ever since SARS, basically 20 years ago, if you got into healthcare, you've been in healthcare, we've been planning. We've been having tabletops, we've been having drills, we've been having all sorts of education, all sorts of training for this very moment to lead for our community. And now's the time we do that. And I expect that from all of you. And I know you can do it. So again, we're gonna get through this. We're gonna get on the other end of this. But in the meantime, stick together. We're gonna get through it and stick together for our community and the ones you love. Okay? So thank you, everybody. Too big of a crowd to ask questions. If you got one, send me an email. I will respond. Like I said, if I don't respond in 6 hours, pick up the phone and call me. Unless it's immediate, you need an immediate response and call me. And same with Olette, thank you for coming. And again, this is gonna be posted in probably the next hour. And thanks, Karen. So thanks, everybody. Keep up the great work, okay?